CF affects every area of your life. It's not just a lung disease. And certainly for men, infertility is one. And frankly, it's a big one. Most men, I think, are afraid to talk about it. And I will bring it up and say, hey, have you thought about being a dad? Have you thought about parenthood?
I was saying things like, well, I would feel guilty leaving you as a single mom. And she was saying, well, I know what this picture looks like realistically, and it's still something I would want to go forward with.
You're listening to Bold Enough to Ask, a Breathe Strong CF podcast that tackles questions for people with cystic fibrosis. Breathe Strong CF empowers the cystic fibrosis community to thrive, not just survive. I am your host, Chad Bouch, a dad living and thriving with CF and an advocate for the CF community. This first season of Bold Enough to Ask is going to focus on the questions men with CF have around sexual and reproductive health. Today we have Casey, a 46-year-old patient living in Olympia, Washington, with his wife and their 4-year-old daughter, Ivy B. He's a graduate of Evergreen State College, and a professional life has been primarily working with children and people with disabilities. He's also owned a comic book store, which is really cool. We also have Bradley Johns with us. Brad is a 54-year-old CF patient. He's married to his wife, Jana, and they have 3 kids, Josh, 25, and then twin 19-year-olds, Justin and Elizabeth. Brad is a math teacher, and he's been teaching high school math and college mathematics for the past 32 years. Brad has a master's in mathematical education and a doctorate in educational leadership. Gentlemen, thank you for joining us. Welcome to our podcast.
Glad to be
Thanks for
here.
having us.
So today's episode is going to be talking a lot about what it's like to be a parent with CF, being a dad, essentially. So Casey, I want to start with you. Tell me a little bit about your journey to fatherhood. Specifically, I would love for you to answer the question, did you always want to be a dad?
I would say, yeah, for the most part, I did always have the desire to be a dad. Um, I grew up working with kids a lot. That's been a lot of my professional life. And yeah, so that was always there. But um, around my mid-20s was when CF started to be more serious for me and more severe. And that desire to be a dad definitely fell by the wayside as I had to focus on myself more. And then also feelings of, guilt for what it would that mean, uh, shackling my partner with raising a kid on her own, or, feelings regarding that. Partly, I just kind of didn't want to go there, just dealing with mortality. And then, thanks to new treatments that have come along in recent years, I was able to sort of tap back into that. And now I'm very pleased to say my wife and I have a 4-year-old.
Yeah, that's great. So our last episode, we talked a lot about IVF and the actual process for getting pregnant with CF. Tell me, did you know you were always going to be struggling with that process, or when did you learn that?
Yeah, I actually learned that. I grew up not knowing that, and I learned that when I was 18 and I was transitioning from the children's CF clinic that I'd been going to the adult one. And just talking with the nurse I was working with on that process, she kind of casually mentioned it in conversation. Like it was like an aside, just like, oh, by the way, did you know you're infertile? And I was sort of taken aback by that. Um, it's not like she brought it up in a rude way. It was just sort of like she assumed I knew and I
Yeah.
didn't. And then it's not like we were able to really spend much time really getting into it or talking about it at that moment because we were working with on other stuff. But
Yeah.
yeah, that definitely did throw me for a loop a little bit just because that had always seemed like a natural way to go. Yeah, when it became clear that like if I were to do that, it would be a lot more involved. And so I did, at some point in early adulthood, talk with the folks at the CF clinic about what exactly would all be involved in that. And I learned about IVF, I learned about different options. And at that point, it was also a lot less successful than it has been, I think, more recently. So yeah, that all gave me a lot to think about.
Yeah, that's good. I can only imagine how that conversation would have been like, "Let's review your meds. Oh, by the way, you can't have kids. All right, well, doctor will be right in." So, yeah, I totally can
Pretty
see how that would
much.
happen.
Pretty much. Yeah.
Crazy. Brad, you have a very unique situation, kinda growing up in Mississippi where you and your wife are living. Tell us a little bit about your father or your path to fatherhood.
Sure. So, um, I guess probably when I learned that couldn't have kids, I was probably early teenage years. So, I don't know. A lot of times, for me, anyways, like when somebody tells me I can't do something, that's immediately the thing I want to do. Right? Like a lot of people are like that. And so I just created more of a desire to try to do that. And while I was in high school, I started helping with coaching t-ball, 4 and 5 year olds. We did that for a couple of summers. So I was around kids already, and then knew that later that would be something I would want to pursue as far as a career, something to do with kids. Was pretty good at math when I was in high school, so just thought I'd be a math teacher. And so the more I got into becoming a teacher and all that, it really created a desire to have children. And so when I met my wife, that was the only thing she ever wanted to do. She only ever wanted to be a mother. She really wanted to be a homemaker and have kids, and I had to immediately tell her, I can't give you that. And so that was kind of an interesting time there. Right after we got married, though, I will say that we were approached by my wife's doctor, and she told her that there were some new techniques that were coming out at the time that she thought would help us have kids. And so she was like, "Yes, sign me up. Well, let's go see whoever we need to go see." And so we started down that process, and probably in less than a year, I say we were pregnant with our
Wow.
child. Yeah. So, and actually, he was the first baby where the father had CF in Mississippi for the couple to go through IVF to have that to happen. So nobody at that point had done that before here.
Wow.
Yeah.
Setting
So
records all over the place. Well, at least all over Mississippi.
yeah. Well,
Yeah.
and then I guess about 5 years later, we tried it again, and it worked again, and so now we have twins as well.
That's fantastic. That's
Yeah.
fantastic. So let's start with that conversation for a minute. For both of you, this goes to both of you. What was the conversation like when you decided kids is something we both just talk about that conversation with your wife that you had to have and specifically like what prompted you? How much research did you do? Did your wife get genetic testing done beforehand? Talk to us about what that process was like leading up to the IVF. We don't have to talk about the IVF. We talked about that a lot on our last episode, but just talk about the decisions that were made between the decision of wanting to, yes, we want to do this to now.
So for myself, the whole process started, but they wanted to just make sure that that I was not able to father a child naturally. So they made us go through the process of seeing the doctor for that, and sure enough, we got the diagnosis that wasn't possible. And I guess when 'cause we were together, she went with me for that doctor visit. That one was a pretty hard doctor visit, honestly. Just, I knew it, but for someone to actually just say, okay, you're absolutely no way not having kids this way, that was pretty tough. Um, and so once we crossed that bridge, then the next thing that we did was to go ahead and get her DNA tested just to make sure she was not a carrier of any type. They did a cheek, like a rub in the
Yeah.
yeah, swab in the mouth and sent it off. And I think about a month later, we got the results that everything was good. no problems there. And so then we went to the next part, I guess, where we went through the sperm extraction. And then she immediately started her treatments to get prepared to undergo the process.
Gotcha. And Casey, how did you bring that or how did that conversation come up between you and your wife? That now was the time to start planning.
Yeah. Well, Brad, it was interesting what you said about how you said your wife always wanted to be a mom, etc. My wife felt that way very much too. And so when we met, because also we met when I was in my late 30s and she was in her like, mid to late 20s. And so that was very much a normal time for her to start a family. And yeah, she really did have to kind of, I think, ask herself, do I want this serious relationship with this person if it means maybe not having kids or that process being a lot more difficult than I had planned on? Um, and I'm very glad she decided, yes, it is worth all that, obviously. And yeah,
Well, like when you guys decided that now was the time to start this process, what
yeah,
types of conversations did you have? You mentioned it a little bit earlier, Casey, to be honest. You talked about, the fear of leaving your wife as a single mom, all that stuff. So what were those conversations like as you started planning to have this family?
yeah. So yeah, we started talking more about that actually during a period where I was having a lot of health issues. There were a few years where it felt like I was in and out of the hospital, every couple months. And it was actually during that process that my wife brought it up. Um, and it was a difficult conversation to have because I was saying things like, well, I would feel guilty leaving you as a single mom. And she was saying, well, I know what this picture looks like realistically, and it's still something I would want to go forward with. And whether it's whatever route we would take to have a kid together, she would really love and value that it was our kid she was raising, even if it meant raising them solo.
Yeah.
And that was a lot to think about. And for both of us, clearly it was a lot. I'm sure she had to do a lot of thinking before even bringing that up. And that was really something I went back and forth on. I completely understood all of where she was coming from,
Yeah.
but it still wasn't easy to think about actually starting that process.
Yeah.
And it sort of just so happened that while we were thinking and talking about that, that's when, there was some new treatments that became available that after I started on really ended up turning things around for me. But even before that, we were talking about like, well, would we want to use a sperm donor? Would we want to, and because I can even remember asking a friend about the possibility of would he possibly be a sperm donor for us, and I can remember calling a friend while I was in the hospital and asking him that, you know what I mean?
Wow.
So that was
Yeah.
during that difficult phase. But then after things really improved for me health wise, thanks to new treatments that became available, then we really felt like, okay, let's do this. Like this feels like a good time now. And that was really nice to just be able to feel safe and guilt-free and not have to have all those difficult feelings and conversations. Not that those wouldn't have been worth having, but boy, was it nice to not have that hanging over our heads while
And
beginning that
Casey,
process.
yeah, you touched, I mean, to be honest, that's one of the biggest reasons why we wanted to do these podcasts, because life is different now with CF than it was 10 years ago. And so these are the questions and these are the new pathways that CF parents and CF dads get to explore. So, Brad, tell me, did you have that type of a conversation with your wife, and what did that look like?
Yeah. So I can remember before we got married and before I even proposed, I went ahead and just laid it out there to her. And I was just like, okay, I know this is what you want in your life. You want to be a mother. But from what I understand, I don't think I can help fulfill that desire. And so, and honestly, she was just like, okay, so maybe we have a different path to follow than what I had thought.
Yeah,
But in the end, it turned out we didn't. So, which is even better. So, yeah.
that's great. So fast forward, we all have kids now. We all still do treatments. We all do all that stuff. What has been maybe one of the biggest challenges that you have faced as a dad with cystic fibrosis that has maybe impacted the way your kids grow up or changed the way the kids grow up? Talk to me about any experiences that you might have where your CF, managing your CF and managing fatherhood kind of intertwined.
Yeah. For me, when they were young, the vest here had just become a popular thing. And so, and it was one of the old, real bulky ones, and it was really, really loud. And so, it was actually
I think we all
perfect
remember. Yeah.
Yeah, it was
to
huge.
help them go to sleep, like, because they needed noise for whatever reason.
Yeah.
And so I would do my treatments, and they would be on their little not bassinet, but the little thing, I don't know what you call it anyways, where they're just laying there, trying to sleep or whatever. And so, uh, and they would just go sound asleep because it was loud.
Love
So,
that. Love using the vest as the white noise. That's
yeah,
fantastic.
that's right. Absolutely.
So one of the best things that my CF did. So first of all, I think, and we'll talk more about this here in a minute, but having a partner who is on board is critical. So like, I remember going down to the hospital for all my hospitalizations and her piling up the kids in the car and bringing them down for dinner. Maybe we sit around and play cards in the hospital room or at the cafeteria. So having a spouse who's willing to help is critical. But I always treasured my time, like with my oldest son, when I would put our little kids to bed, and then he and I would go downstairs to where my treatment stuff was, and we would just hang out, and we'd watch The Office together. And, you can call me a bad parent for letting my 12-year-old son watch The Office, but that's fine because we still have, we'll make references all the time to Office pranks, jokes, lines, whatever it is, because it's just a shared memory we have together, that honestly, I don't know that I would do if CF wasn't involved with it. I love that we get to do that, and it's been fun. And so, yeah, when we can introduce our CF to our kids and make it almost just a part of their life, I think is critical. So, what are some things that you guys have done to help normalize your treatments, your hospital stays with your kids? Casey?
Yeah. Well, for me, I just because of the timing, like I was, kind of speaking to, um, I really have been very fortunate to have a relatively, let's say, a relatively non-CF fatherhood for the most part. Only recently, just a month and a half ago or so, I had my first hospitalization since becoming a dad. And and also my daughter's only 4. So she's also just very much still becoming more aware of the world and how, everything works. So she really didn't see me do treatments until, well, there are treatments she didn't see me do until recently because I had to do them specifically because I was facing a really strong infection. For instance, she hadn't seen me do nebulizer treatments until recently. And she was a little, she was just kind of interested in it. She was curious, Um, but yeah, she was, so I kind of showed it to her and explained how it works and how, you kind of breathe in here and then, the steam kind of stuff comes out here. And we have a cute picture of us, sitting together with me using it. But yeah, and I know that probably sounds kind of crazy that I literally didn't have to do a nebulizer in front of her until she was 4. But like you said earlier, Chad, it's a new day these days. So it's just,
Yeah.
things are just so different now. Um,
Yeah.
but yeah, and that was, so like I said, this was the first hospitalization since she had been alive. And, you know, it, I was in the hospital for 6 days, and that was the longest we've been apart. you know?
Mm.
So that was really difficult for both of us. We don't like being apart that long, it turns out. So, you know, yeah, she would visit, either my wife or my parents would bring her like at least every other day during that time, and we would at least FaceTime every day. But, it's not the same as being at home and comfortable and, so yeah, and the first time she visited the hospital, I mean, she hadn't been in a hospital before, other than when she was born, but I don't think she remembers that.
I know.
Um,
Yeah.
yeah, right. So, yeah, she was definitely, there were a lot of big feelings, I mean, it's a full sensory experience to be in the hospital. She kept asking, like, what's that noise? And I realized these are all little things that I have tuned out long ago. And yeah, like, "What's that noise?" "Well, I don't know, it's a machine in someone else's room." "Well, what's it doing?" I don't know. It's monitoring their heart. I don't know. It's stuff that I can't worry about because I need to focus on myself is what I sort of wanted to say. But yeah, but, anyway, that was all a new experience, and there were definitely a lot of feelings. One of her teachers at preschool said that during their circle time, IVB said like, "Hey guys, I need to tell you something. My dad is in the hospital." So it was definitely something that she understood the seriousness of it, to an extent, to whatever extent someone her age is able to. And there's been a lot of, big feelings since then too. Like I said, it was only about 6 weeks ago. But things have returned to normal and I'm thankful for that.
And so, Brad, you and I are similar in that we've had children a long time, way before new treatments came along, probably multiple hospitalizations and various other things. Tell me, what were some of the things that you and your kids did to help normalize your CF care?
Yeah, so while you were saying that, I'm remembering in my mind many, many times where we've had to do homework while I was in the hospital. They would come to the hospital to see me, and especially my oldest, being a math teacher, he would have math homework, and sometimes he would be struggling with that, and so we'd have to go over stuff while I was in the hospital. Uh, so I mean, it's just you do what you got to do, right?
Yes.
So I try to put them before myself as much as I can, in every way, and so because it's not just me that I'm trying to take care of anymore.
Yeah, and that's the balance, right? Because we do have to take care of our family as much as we can. But at the same time, we have to balance that because, I mean, 10, 15 years ago, we had to also make sure we were taking care of ourselves a
Mhm.
lot. And that took a lot longer time frame than it does nowadays.
Yes.
So you're right. That's always been the balance of prioritizing us over care for them and all that stuff. So that's a good example. So talk about specifically your medications. Like I remember my kids always asking me like about my medications, and I even have pictures when we were younger of playing. Maybe it was PlayStation 2. I'm older, so maybe it was Atari. Who knows? And my son sitting next to me, and he would have a unmedicated nebulizer in his mouth, just holding it because I was doing that too. So tell me, how have you guys protected your kids from medications, or even helped normalize even that aspect of it, Brad?
Yeah. So, being a teacher, I have to be at work really early, and so my day typically starts at 4 a.m., where I would do treatments to get all that taken care of first. And that would take me probably 45 minutes to an hour each day, especially back before newer treatments came out. So everybody was pretty much asleep in the morning time, anyways, uh, when I was doing those. So they never really saw the biggest part of my treatments, because morning is when I chose to do the biggest majority of them. Um, but then, like with stuff, especially like when I'm taking pills and stuff. I can remember when they were growing up, I'd be like, "Hey guys, you want to see a magic trick? Watch this." And I'd be like, "See these pills? They're like 5 or 6 pills. Let me show you how. Watch me swallow them." And I'd just swallow them real quick, and they'd be like amazed. And I'd do it again. I said, "Okay, I got to take some more anyway." So I grab another handful, and I'd swallow them again. So, but yeah, that kind of stuff, and that they would get a kick out of that too. So, and when they
Yeah,
have
that's
friends sleep over and stuff, they would be like, "Wow." So
yeah, that's a magic trick that we've all showed our kids' friends. I've never been able to do it without water, but I use a very minimal amount of water, and it's always a fun trick. Casey, how do you incorporate IVB, or even just with her being 4, just protecting her from the curiosity of your medications?
Yeah, well, for the most part, the ones she's seen me do are just pills, and I mean, she's so young that she knows that that's part of my morning routine, that, I need to take my medicine, and she'll comment on, like, the different colors of them and stuff like that. But yeah, but also, like, well, for instance, um, we have 2 dogs that are getting older. They both take a fair amount of medication, every day too. So that's kind of part of our morning routine is, we'll wake up, I'll get her some breakfast, I'll take my medicine, I'll get that ready, I'll get the dog's medicine ready, and, then I'll come over and sit down with her, and we'll eat together. But yeah, she's very accepting of, like, daddy's gonna be in the kitchen for a little while, getting whatever medicine and, whatever else he does in there, ready.
Very cool. Yeah. Speaking of just keeping our kids involved as much or as little as we can, I remember when my son went over for his very first sleepover at another friend's house, and his mom called us up and told us a story about how when they were sitting there playing, I don't know what they were playing, but my son turned to his friend and just said, "Hey, when does your dad do his treatments?" Just assuming that, well, my dad does treatments. I'm assuming all dads do treatments at this point. So, we've always done as much as we can to help normalize it, but that's the kind of stuff that our kids get, you know? I think they understand things better than some other kids. Like our house always we're washing hands all the time, right? Growing up, it was always making sure we're cleaning things up. And so I think that has been very beneficial in my kids' life going forward and so on. I just think that growing up with a parent with CF obviously has its disadvantages. There's those times in the hospital we miss out on, but I do think there's advantages too. I mean, my son learned a lot about life at an early age. He was a better communicator with adults growing up than he was with kids his own age. And honestly, I think the fact that he's had real life stuff happen to him and his dad has been in through that kind of process helps him mature and develop some more. So I do think there are obvious disadvantages, but I think the benefits are there if you can find them. So, how do you talk to your children? Brad, I'd be really curious with you. Like, how did you bring up your CF when they were younger to try to help educate them?
I don't think there was ever just one conversation. I think it was just kind of the normal everyday life, seeing that you're doing you're taking the pills, you're doing the medicines. And I think it wasn't until I probably had my first hospitalization where we really had to talk, daddy's not doing well, he's feeling bad, running fever, that kind of thing. And we need to make sure that he gets the care he needs. He's going to have to go be in the hospital for a couple of days.
Gotcha. So just lots of little conversations basically around the different events. Casey, how about you? Have you talked to or have you and your wife talked about how that conversation might go when Ivy's older?
Not really. No, we haven't really. Like you were saying, Chad, with, like, your, expecting that all dads do treatments. I mean, kids they just accept what's in front of them as the norm, and it is normal to them. And, you know, so I think it'll all just seem natural, it's all just you know what you know what experience you have, and that's how you view the world. This topic reminds me of I can remember years ago seeing an interview with Michael J. Fox, and it was around the time I think he had a book that came out specifically talking about his Parkinson's and how that how that kind of affected his family. I just remember him saying something like, "Well, I mean, no matter what, like your kids still think you're cool." And like I think that's true. I think whatever, I mean, whatever is going on, whether it's that you're in the hospital regularly or you have to do all these treatments or whatever, like, you know, the important thing is like if you're showing up for them and you're a good parent, your kids will think you're cool, to a
Yeah,
point.
for sure.
I have a 4-year-old, so she's still in the phase where she thinks I'm cool. You guys have, teenagers and whatnot. So I know that doesn't last. I hear that doesn't last forever. I'm sure that in my case it will. But with everyone else, I've heard. But
It
anyway, yeah.
fades. But it comes back too. My 23-year-old loves hanging out with me again now, whereas the twins have no desire to hang out with me right now, and I'm weird. So yeah, that makes sense. Yeah. So for us, we've had that conversation obviously. So in 2016, when I got my lung transplant, specifically when I got listed for transplant, we had to have that conversation. Particularly with my oldest son, he was an eighth grader, maybe ninth, yeah, eighth grader at the time, I believe. And so we did have to sit down and have that conversation, what it might look like for transplant. Definitely had some miscommunications when we talked about like what the benefits of the transplant were. He literally thought that by getting a transplant that added 1 year of life to me. So when I went away and got my transplant, he really started struggling because he thought I only have a year left with my dad now. So thankfully we got that straightened out relatively quickly after he disclosed that. Kids internalize a lot of stuff, and so that's always been a little bit of a struggle as a dad, and having to try to incorporate that as they grow older and teaching them what CF does and how it impacts us. As you'll learn, and Brad, as you probably know, it's a very easy topic for papers for our kids. They have a built-in expert, and I literally think I have been quoted in all three of my kids by all three of my kids in various papers through school. So uh, there again, the minor benefits are out there if we're willing to really look for them. So I want to talk now a little bit about our mental health, because first of all, being a parent of any kind nowadays is difficult. It has changed. We talk about, our new treatments that have come around to help us extend life. Kids face way more stuff than we ever had to do as kids growing up. But our mental health around having to manage our own care, helping to look out for what's going on with them. What are some things that you guys have had to do, Brad, probably more so than Casey so far with the 4-year-old, but Brad, to help manage your mental health? What are some things that you do to help just kind of impress upon your kids how important it is that they're maintaining their own mental health well-being?
And so I would start by just saying, I think with my daughter, especially the whole going to the hospital thing, I think that had a bigger toll on her. She's had more issues with mental health just because I really think just because she saw me right before all of the treatments came out, and she was old enough to see that I was getting sick, and I was getting sick a whole lot more frequently, and I was having to leave and be in the hospital. For myself, there's a point where you get to that you just I've got to figure out something else to try because this isn't working very well. And so talking with uh, my social worker, and we started having some sessions where I would just go and talk to them about making sure that I was in the right frame of mind and not getting to the point where I was getting depressed, just depression taking me down into a dark hole. I wasn't that person growing up. I was always bright and bubbly and very outgoing, and I wanted to continue to try to do that as much as possible. So
Yeah, it's just so important too, because I do think my daughter as well had the biggest impact on her growing up, and even now when I get sick, she's the one that's the most concerned. The boys are like whatever, but she wears her emotions more on her sleeve and is generally more concerned about what happens. Casey, all the fun stuff you get to look forward to as you get older and Ivy gets older. But uh, have you had to do anything yet with helping her manage that, especially with your time in the hospital?
Yeah, I mean, an issue I have mental health wise that I bet a lot of us is anxiety. That's the main one. We pretty much all have medical trauma in our past and have anxiety and PTSD and whatnot as a result of that. And, that can be really difficult. I mean, our kids really test our patience and our anxiety levels and all that stuff, that comes with the territory. And I've had to remind myself, my wife has had to remind me also that, the better I am at regulating my own anxiety, the better IVB is going to be at regulating her emotions when they get overwhelming. And that can be a challenge. Yeah, I mean, I'll be honest, that's a real challenge, still. And it's something I just keep trying to be better at. I mean, I was a stay-at-home parent for a while. So the person she's hanging out with the most, her main role model, is having low-level anxiety attacks occasionally. She's gonna copy that behavior to an extent. I mean, she's gonna think, well, that's how you react to things. That's normal. So that's been an ongoing challenge for me.
Being a parent is hard work. Being a parent with CF makes it even more difficult. So I really appreciate the fact that you're willing to share. Before we wrap up today, is there anything else, any other kind of moments of being a dad that you want to make sure we talk about today?
Only that like it is absolutely and completely my favorite thing I've ever done. It's just the best. I mean, I didn't know. I knew I had a good feeling I would enjoy it, but I had no idea how much.
Agreed.
Yeah, I'd say
Brad?
definitely. Just it's hard work, but it's fulfilling work. It's my most important work. So taking care of my family, making sure that they have what they need, and just being able to live life with them. So it's good stuff.
It's worth all the pain that we go through. I'm curious, to speak of that, Casey, any more children coming for you?
We have talked about having one more, and since, like I said, we used a sperm donor, we went that route, and that is the route we would go if we wanted to have more. So, one kind of nice thing about all the steps involved in us CF dads becoming dads is we really can plan for it. We're not gonna have unexpected, surprise pregnancies that can derail life, so we can really prep for it. And so that is kind of unique, to be able to say, like, well, yes, my wife and I have talked about having one more, not more than that. And, I mean, it's just most parents aren't in that position where and so, yeah, that is something we've talked about, but we don't really want more than two, I think. Although, well, with you guys, the IVF, I mean, Brad, you had twins. I'm sure that wasn't something you were expecting or planning for necessarily. So there can still be surprises.
Brad, I assume you're done, but next for you, grandkids?
Yes, that would definitely be the the next step. No more kids for us.
Yeah.
Our oldest is 25, and so hopefully at some point he'll meet someone like I met my wife, and then he'll have kids. They'll have kids of their own, and we'll be grandparents.
Yeah, that's the dream, I've heard. So I'm very excited for that opportunity someday, maybe too. But yeah, we'll see how that works out. Things are not always in our control when it comes to the grandkids, right?
The idea of three men with CF talking about even the possibility of becoming grandparents, just like let's appreciate that. You know what I mean?
For sure. You're
Absolutely.
100% right. I was talking with Brad earlier, and his parents were told take him home and love him because he's not going to be here very long, much past 3 or 4 years old. So the fact that we get to have that conversation about grandkids nowadays is
Mhm.
amazing. So I agree. You're right. Appreciate whenever we can. Next, I'd like to welcome Dr. Aaron Trimble, a pulmonologist affiliated with the Oregon Health and Science University, where he was the Adult CF Program Director from January 2021 through November of 2023. He's a member of multiple working groups focused on sexual and reproductive health for people with CF and pays particular attention to men's health. So Aaron, why don't you go ahead and introduce yourself and tell us about your life and your history with cystic fibrosis?
Chad, thank you so much. I really appreciate it. And thank you for the invitation to be here. So I'm a pulmonologist. I care for adults with CF. I'm absolutely passionate about that. That's the main thing I do when I wake up in the morning is think about caring for people with CF. I've been doing this for just over 10 years. I really got interested in caring for people with CF right at the beginning of my pulmonary training after I finished residency and started my fellowship in Chapel Hill at the University of North Carolina. And I really had an interest in doing research and to help really advance the field. It was very meaningful for me to care for people with CF when I was in training. And I did some research in mucus clearance, but really later on, kind of a series of events got me interested in reproductive health. After my training, I moved back to the Northwest, which is where I'm originally from. And I've been here for about 7.5 years. And it's just been a real journey. Certainly, there's been a lot of changes in CF care with new therapies. It's just been a real journey and a real joy. So thank you so much for having me.
Yeah, we love it. So, questions that are bold enough to ask is what we're talking about. And specifically, we're talking about men's reproductive health. Really want to focus on what that looks like and being a father and how that affects people with CF. So you've been involved with this aspect almost from the beginning. So I want to ask you just kind of a general question to kind of kick us off here.
Sure.
If I was a new patient in your clinic and I came in with my wife in tow and we said, we want to start looking at having kids, starting a family, what does that look like to you? And how do you have that conversation with people?
Yeah, well, first off, I would love for any new patient, anybody I'm meeting for the first time, any male specifically, who is asking about that. But I'll also be honest, it's actually pretty rare that comes up, and more often than not, I will bring it up. But if you ask, what does that conversation look like? I'll often really try to feel out kind of what people's goals are, what are their thoughts. Would say, are you're interested in having children, and I'll also ask what they're familiar with. What do they know? What do they know their options are?
Yeah.
It's most men, I won't say all, already know that they are almost assuredly infertile. Now, if you Google it, you read about it, people say, 90 plus 95% of men with CF are not naturally able to have children. And, in medicine, we can never say something's 100% true, but honestly, male infertility in CF is as close to 100% as you can get without saying 100%. And the few reported cases where men have been able to naturally father children, their diagnoses of CF is extremely mild, and if they were cared for by another provider, they might have said, this isn't actually CF, this is something else. So for anyone, we avoid the term classic CF. It's an older term, but if you have severe CF, or especially if you've got double delta, which about half of people with CF do, you can pretty much count on not being able to naturally have children. So options are really important. Many, but not all men know that it is possible to have your own biologic children, to genetically with a female partner conceive. However, it is going to require sperm aspiration. It's going to require a procedure done usually by a urologist who will do, it's not surgery in the operating room, but usually an in-office procedure but oftentimes it does need to be done in the operating room, but one or the other. They can do a small procedure to go into a testicle and remove some of the fluid in the testis, which has sperm in it. That can then be used for in vitro fertilization.
So how do you work with the gentleman and couple ideally to get them from that first moment into your office to going into the urologist? How does that work?
Yeah, unfortunately, a lot of times things are really determined by insurance. These procedures are really expensive. So if people's insurance has a preferred provider, we'll place a referral and go about things that way. In the world of CF, there are starting to be some funding opportunities or some grants that are available, and so often those are tied with specific providers, and those actually don't require a referral. We don't have to physically, place a referral or talk to other doctors. But I think something you raise is how do I think the way, if I recall correctly, you phrase it is how do I prepare them? And
Yeah.
I think there's a lot of conversations to be had there about, hey, this is a big deal, becoming a parent. It's exciting, but it's also really scary. You
Yeah.
still have a diagnosis, and most adults with CF, men and women, grew up kind of thinking they would be dead by the time they were 30. And so the whole notion of being a parent, is something, I don't have CF. I kind of grew up thinking I'd be a parent someday, and I am a parent. I have 3 boys of my own. But I didn't grow up kind of expecting or anticipating that I wouldn't live past, age 25, 30, 35. And so I think there's sort of some psychological development or process of thinking, being open to having children that is a really tough thing for people like me who don't have CF to truly understand. And everyone is different. If I've learned anything in the more than 10 years of caring for people with CF, everyone's different. Yes, it's one disease, but no, it's not one story. Everyone has their own story and their own thoughts and approach and feelings, and of course, the partner. And I think my guiding star in having these conversations is being genuinely curious as to who they are, what their thoughts are, where they're at, and what are their hopes, what are their fears. Some people have it kind of all planned out, and they're like, I want this. This is how we're going to do this. We've identified this. Here's our funding streams. And I'm like, great. Do you need anything from me? I don't think
Right.
I can help you. Most men, I think, are afraid to talk about it. They're thinking about it. It's embarrassing and it's awkward. And I try to create space and I will bring it up and say, hey, if I'm meeting somebody for the first time, if they haven't brought it up, to say, have you thought about being a dad? Have you thought about parenthood? And, or are you in a relationship? Even if you're not in a relationship, have you thought about this in the someday? I see a lot of 18, 19, 20-year-olds. They're not necessarily in relationships. They're often, saying, well, maybe in 5, maybe 10 years, I'll think about it. But, I really try to create space, even if that's not going to be at that visit, in the future, to establish rapport, to establish relationship, to say, hey, CF affects every area of your life. It's not just a lung disease. And I am a lung doctor, but I am a CF doctor. And I want to create space to say every part of your life that CF touches, and certainly for men, infertility is one. And frankly, it's a big one.
Yeah.
That's fair game. And I want to be there for that, even if I'm not going to be the doctor who's directly treating or caring for that.
Yeah. So that you brought up a couple good points there. So when you're talking with these, maybe a couple, maybe just the man at first, what are the pros and cons that you kind of bring up as to, what's life like with kids and being, still having your diagnosis?
Yeah. So, there are, I can say as a parent, there are a few, the pros, the joy of being a parent is just massive. And that's also different from everyone. There's, everyone I think experiences parenthood a little differently. And, the pros, if you will, of going through ART, specifically maybe what you had talked about in the last episode, there is some advantage there versus some other options, right? You can go to a sperm bank and a partner can be impregnated through intrauterine insemination. That doesn't always work. It can also be more expensive maybe than people realize. And there's often kind of this weird, funny thought that men carry with them. I know, because I've talked to many who are like, yeah, I mean, they're my kids. I know they are, but genetically, biologically, it feels
that'd be tough.
weird to say, some other man's semen's in my partner. Like that just, do you let yourself think that? Do you let yourself kind of, what does that even mean? But yet that pathway has absolutely created real, true families for men with CF and people with CF. And so I don't want to undermine that at all. But an advantage of undergoing ART is that genetically, biologically, those are your children. Those are your offspring. Your genes are passed on. Another, and maybe you already talked about this, but I really think it's really important when I talk to a man with CF about options and pros and cons, is embryo adoption. Undergoing in vitro fertilization for any couple, they don't have to have CF. Often more embryos are developed through that process than are going to be ultimately transferred into the female partner. And they're kept frozen and can be discarded. Some people have ethical concerns about that, and they're just sort of on ice. And those embryos can then be put up for adoption for other couples who want children, want to adopt, but allowing the female partner the option of having embryos transferred and going through a pregnancy. And there's a little equality there because those embryos that are adopted are neither genetically moms or dads.
Right.
They're as if those children were adopted from that couple that underwent in vitro fertilization. But it still allows the opportunity for pregnancy, to give birth, nursing, all of those really, truly important bonding experiences for the female partner. But there's at least some degree of equality. And frankly, that's often a less expensive choice than either maybe even in intrauterine insemination, going through a sperm bank, or certainly undergoing IVF. So that's one pro and con. I always want to mention that people know what their options are. If going through in vitro fertilization or ART seems really like I'd love to do that, but I just don't know how I'd ever pay for that. That's something that comes up. I mean, the cons are almost always the cost. Insurance doesn't often cover this, and it just seems really out of reach. But I still have been deeply appreciative of organizations that are supporting reproductive health and are in some cases providing grants for couples involving a male with CF to undergo in vitro fertilization.
And I want to back up just a smidge too in this because I want to talk a little bit about genetic testing when it comes to both the male with CF, which might seem odd, but there's definitely some things that can be uncovered, and then also obviously the wife or the spouse. And so what does that? How do we incorporate that into this conversation too?
That's a great question. So, but everyone going through in vitro fertilization, partners are going to be tested at some point for diseases, essentially carrier screening. Across the U.S., about 1 in 35 people are carriers for CF. So that female partner has a 1 in 35 odds, maybe higher, especially if she's Irish descent, or maybe lower depending on ethnicity. But 1 in 35 is a pretty safe number to sort of assume. The male partner is going to pass on a CF gene. That is going to happen. You got 2 copies. One of them is going to be passed on. So if that female partner is a carrier, there's a 50-50 chance that kid will have CF. So if you do the math, that's a 1 in 70. If you don't do any testing, there's a 1 in 70 chance that a child, even undergoing in vitro fertilization, will have CF. There's a couple things that I think are worth mentioning there. One is there is an option to do pre-implantation genetic testing, PGT. So this is a step and part of the IVF process. It's not always done, but it can be requested to be done in this case, especially if the female partner is found to be a carrier, where they take one cell from the embryo, don't destroy the embryo, just take a cell and test that embryo to see if that's an affected embryo. Wow. And then you can elect to only implant embryos that are unaffected with CF.
Yeah. That's incredible.
But and that is something that we in the CF clinic can often help with, is connecting people with genetic counselors. We often provide a fair bit of genetic counseling ourselves. At our center, we have a genetic counselor who we work with and sees a lot of our couples.
So how many adult men do you see that are also dads? Obviously, ballpark number.
Yeah, probably 25, maybe.
And have you noticed anything different with their health? Like, had being a
Yeah.
dad caused extra stress on their CF stuff? Has it been less stress?
Yeah.
The joy of parenting? How's like,
That's a great question, and one that I will maybe take a moment to shamelessly promote a study that's called pwCF that's being done. We're a participating site, but Dr. Tracy Kazmersky and her lab at the University of Pittsburgh is really looking at outcomes for people who become parents for the first time. Does it affect their health, and does it affect their mental health? What are all of the different aspects that parenthood can touch, because kids being little, they're in preschool, daycare, bringing home all these germs, these respiratory viruses. That can be really scary, especially if you've had like a lung transplant or something. I mean, that can be really, really powerful, really important. In my own personal experience, I think I see both. I think I see a lot of men who the joy of parenthood, the drive of living not just for yourself, and not just for your partner, but also for a family, can really help drive men to really invest in themselves and their health, and to be the best version of themselves that they can be. I think of a patient who I saw in the last few weeks who's become a dad the second time through in vitro fertilization, and he was really tired. And he's not sleeping a lot. And he's got 2 kids under the age of 3. And we talked about keeping up with treatments and keeping up with his care. And he's like, yeah, I don't know how I'm going to do that. And it's a real balance. And I think in some ways, maybe his health there is a bit of a trade-off there, I think, but it seems to be pretty small. That's why, really excited to have a formal research study. Been a lot of changes in the last few years. We have really effective treatments that have absolutely transformed the lives of many, but not all people with CF. And I think that gives a lot of confidence and hope that, yeah, actually, maybe if I miss some treatments, I'm going to still be okay. And I can have the strength and the energy to have some sleepless nights and support my partner and care for this child and balance caring for myself, caring with this disease, hoping for my future, and also truly giving myself for my child, which is, part of I can't think of another word other than sacred, but like the sacred part of being a parent.
yeah. Well, Dr. Aaron, thank you so much for your time today. Lots of great information there for us to unpack as we try to explore what fatherhood looks like as we continue to develop better treatments, like you said, that allowing us to live longer and be better dads. So super grateful for your time today. Thank you for joining us and continued great work.
Well, thank you so much for having me. It's something I'm really passionate about, and I really appreciate the opportunity to have this conversation, to share some information. I really appreciate it, and all the good work that you're doing. As doctors, I always like to say I have a hard time calling myself an expert on a disease I've never lived with. So I really appreciate that there's some people with some lived experience, lived expertise that can be true leaders in the field. So thank you so much for your time as well.
Thank you for tuning in to Bold Enough to Ask. You can learn more about Breathe Strong CF by visiting breathestrongcf.org. Please subscribe on your preferred platform. Be sure to like and follow us, and send us your questions to georgia@breathestrongcf.org. Special thanks to our episode producers, Georgia Brown and Catherine Russell. Branding and design by Rachel Rockhold.